I'd like to turn it over to Louise Rogers, Director of San Mateo County Health, to provide an update on the COVID-19 vaccine rollout.
Good morning, everyone. I'm really glad to see you all here. And I want to take this moment also to just express enormous gratitude for the work that you have already been doing in your arenas and in partnership to respond to the earlier phases of the pandemic, which we're very much in the middle of. I also just want to acknowledge, reflecting on the words in the word cloud, how it really just reinforces the words, which are very sobering. We do have the word hope, but the reality is we have a lot of concerns. And so I'm very hopeful and I'm confident that working together with you all, we can really take this to the next level and support our community members that were most concerned as the vaccine rollout occurs, could be left behind. That will not happen in San Mateo County. That is our highest purpose as a group, is to reach those communities that we know will not be reached if we don't use the San Mateo County secret sauce, which includes enlisting every one of you to help us do the best job possible to reach everyone. Next slide. Well, we can move on to the next slide, actually. So my job is really to set the table so that we all start out in this process with the same information about what we know. And then everyone will be able to engage in this process, most effectively, feeling like they have the information that they need about the current state. And as Peggy noted, there are a lot of questions, and so we're making time for that as well, and we'll continue to do so as the process unfolds. The first thing that I want to say is, that we know that a safe and effective vaccine is one of the most important interventions to end the pandemic. I want to acknowledge, as many of you have said directly to me, that the results of the pandemic are longstanding, that it's very simplistic to say we're going to absolutely end it, knowing that the impacts in our communities are going to drag on, particularly the economic impacts. So that's not what I mean to say. What I mean to say is that the safe and effective vaccine is really the turning point to be able to get us fully into the business of recovery, which we know involves many dimensions. And so there are two vaccines that are currently being distributed by the federal government, the Pfizer vaccine and the Moderna. And the federal government purchased them all. They are being provided by the manufacturers at no cost because they have been subsidized. And there are other vaccines on the heels of the first two. And we're very hopeful that there will be multiple choices in the end of the day. But right now there are the two vaccines. And they have been validated by top medical experts, and I'll say a little bit more about that, to be safe and to be effective. And I want to acknowledge that the medical experts that have weighed in regarding the vaccines are autonomous and independent. Not just people who are employed by the government, but independent bodies of medical experts that have weighed in. And the plan is, led by the federal government, that these vaccines will be rolled out to everyone in the nation who needs them in phases, out to groups based on their risk and level of exposure. And most recently, I think you've probably heard in the news that age is a big consideration because risk definitely correlates with age. And we know that older adults are more at risk. And the federal initiative focuses on reaching everyone by later in 2021. But I also want to acknowledge that we have a change in federal administration happening. And our new president has lots of ideas about how to speed this thing up, how to get it to scale faster. And so I want to acknowledge that all of the things that we know now about the plan, they could be improved, they could change, and that would be a great thing. What I'm sharing with you all today is what we understand to be the plan today. Next slide. And so we have been really encouraged that the partnerships that are necessary to reach everyone in the nation, the state, federal, and county governments, have been very focused on three principles to ensure safety, transparency, and equity in the process. And we see that these three principles are in play at the federal level through the process that the Centers for Disease Control in Atlanta and the FDA in Washington, the Food and Drug Administration, have been leading. They're very much in play there. We see that in their process, and you can go online and you can see the minutes of their meetings. We also see this very present in the process in California. The governor has convened a vaccine task force that has a robust community advisory committee chaired by two women of color with deep roots in equity work. The Surgeon General, who some of you may know, is Nadine Burke-Harris, whose work most recently in San Francisco in the Bayview is deeply steeped in equity, and Erica Pan, who is the state's chief epidemiologist, also has been a health officer, and her work as well, steeped in Alameda and in Oakland in the Asian community, is also deeply rooted in equity. And the process that they've been leading is really robust. So one of our efforts here locally will be to try to connect as much as possible with the process that they're leading. And they're very transparent and have posted a lot of information about how they've been using the input that they received to actually modify the state approach. And just a very recent example of that is that on Wednesday night, they convened an emergency meeting to discuss the state contemplating changing their approach to reduce the age limit of access to the vaccines. They were contemplating going to 65. And at the time, they also contemplated introducing other populations and approaches. And the committee really assertively pushed back on some of the ideas, and the state honed in on an approach which was to focus on age. And I take that as just one example of many of how the state is actually really incorporating feedback into their process. And then pivoting to the local level under the leadership of Supervisor Canepa and Supervisor Slocum, our process locally will partner with you all to really hone in on these three principles to maximize safety, transparency, and equity in all of our local activities. Next slide. So I wanted to take a minute on really how the decisions are being made in this process, because there are very distinct processes underway for the rollout of the vaccine. Eventually, there will be enough vaccine for everyone who lives in San Mateo County, and we're laying the foundation now to make access as easy as possible, focusing on communities that may be the most challenged in that access. And because at this point, the initial vaccine supplies are limited, the federal government has created guidance through the process that they have and handed that guidance to California, which they have further detailed regarding who will receive the vaccine and in what order. And so at the federal level, there is a careful, separate scientific review by the Food and Drug Administration for each of the vaccines. They review them one by one, and they take days to review all of the scientific information before they determine to approve a vaccine. And then at the federal level, the Centers for Disease Control convenes an autonomous advisory group. They're called the Advisory Committee on Immunization Practices. And they are the same group that gives advice on every other kind of vaccine that is allowable, in the United States. And they provide, the ACIP has provided broad categories of priority populations to receive the vaccine, given the limited supply. Of course, when the vaccine is broadly available, then there will be no need anymore to have these priority populations. And the advice is then given to the state, and the state of California which has not completed their process yet, it has an ongoing process to review the guidance from the federal government. And even this week, they were introducing significant changes regarding the priority populations. And as I mentioned, the state has a vaccine task force. There are 3 different components of that. There's a safety group. There's a community advisory committee, which I mentioned was convened on Wednesday night. And there's a policy guidance committee. And each of these groups provides the recommendations to the state government regarding what will happen in California. And California is leading this essentially under the office of the governor and with all of their departments engaged. And then what happens is the state allocates vaccine supplies, and they do that to the county, to every county in California, including San Mateo County. They allocate the vaccine supplies, which is the vaccines themselves, directly to all of the large multi-county health systems. And so in San Mateo County, Kaiser, Sutter, and PAMP, Dignity, and AHMC Seton are all supposed to receive their vaccine directly from the state government, and the state decides how much they'll get. And as you may know, most of those organizations operate on a broader scale than just in our county. And then we in the county are responsible for assigning the quantities to the smaller providers that are not the large multi-county health systems. Next slide. And examples of smaller systems would be Ravenswood and Northeast Medical Services and small clinics around the county. And the manufacturers of the vaccines, they actually send the vaccines directly to the organizations that are going to administer the vaccines. They don't send them all. For example, in the case of the county, they don't send them all to us. The vaccines are very fragile and they require a lot of special care, including freezer capacity. And so the manufacturers, once they know who to send them to, they actually send the vaccines directly to those organizations rather than having them change hands. So there are 3 different pathways for the vaccines, building on what I just said. The federal government in the first line here is sending the vaccine directly to the Veterans Administration, including in our county and in our region. And I know personally that they have been engaging their patients about accessing the vaccine after they directly vaccinated their staff. The federal government is also sending vaccine directly to Walgreens and CVS pharmacies. And we hope that they'll expand that to include all pharmacies. And right now, those pharmacies are focused on long-term care facilities. And in San Mateo County, we know that all of the long-term care facilities that are skilled nursing facilities have been scheduled for vaccines for all of their residents. And the CDC is, the Walgreens and CVS partnerships are working on the other congregate care facilities as well. And many of those other long-term care facilities have also been scheduled. The second pathway for the vaccine is through Kaiser, Sutter, PAMP, Dignity, and AHMC Seton. And the state decides how much vaccine they will receive, and then it is shipped directly to them. And we locally are trying to stay coordinated with them to understand how much they're receiving so that we can know what the picture is in our county. And yesterday, we had a very encouraging meeting regarding their willingness to share information about that so that we can all know not just what Kaiser is doing in the county, but how much they've received in the county. I will mention that we have learned directly that Kaiser in particular doesn't have enough supply at this point. And we have learned directly from Sutter that they are not worried right now, but since Kaiser's concerned about it, now Sutter's concerned about it. So this is something that we're all very focused on because we know that we in the county actually don't have enough vaccine yet either. So the quantities are determined by the state, and then the vaccine is shipped directly to the entity that will actually administer the vaccine. And then the third row is the county, and at the local level, in addition to coordinating and focusing a lot on communications, which as you've heard earlier is absolutely critical to be able to get the reach that we need, we distribute the vaccines to the entities and arrange access for the people who do not have insurance and do not have a way to get the vaccine through the large entities like Kaiser and Sutter and the large healthcare systems. And so our focus continues to be, as it usually is, as a safety net for the people who are most vulnerable. Next slide. So to recap that responsibility, the county is coordinating and allocating vaccines to the small clinics, the small providers. We are having to follow the guidance that the state and the federal government created, and I'll focus on that in a minute. And then once an entity receives the vaccine, so for example, Ravenswood, receives the vaccine, they also are following the guidance from the state and the federal government, and they're managing the distribution within their clinic, but they're also following the guidance. And then the county is responsible for directly vaccinating certainly any of the healthcare workers that work for us in the clinics and the hospital, the health workers that are involved in providing services that are now allowed under the first population that the state has approved, the emergency responders. We're already working through the paramedics and the fire first responders, clients who we directly serve. And it's important for you all to know that the county health system through its clinics interacts with about 100,000 residents. So that is absolutely one of our priorities. And then, as I mentioned, a safety net. Communication and outreach, sharing information about the vaccine and supporting the vaccine uptake, especially in the lowest income communities. And then we believe that as a partner, especially using your input, that we can probably influence the Kaiser and Sutter and the large healthcare entities to engage in a unified approach in this county. And I was really encouraged yesterday in a meeting that we had that they were very interested in working together, especially on communications and outreach. Next slide. So now a little information about who's able to get the vaccine now. And this has been a bit of a moving target because even yesterday, the state actually expanded the populations. The challenge is that they didn't increase the supply of the vaccine. And so that is something that we have to work on. But right now, phase 1A, which is already underway, is to vaccinate healthcare workers, really broadly defined, people who work in healthcare settings directly. That includes the people who are helping to clean the space, support the space, the professionals, the non-professionals, et cetera, clinical and non-clinical. And we estimate in our county that there are 38,000 people who are in the healthcare worker group. Medical first responders are included, the paramedics and the EMTs and the fire first responders. And I also want to call out the in-home support services workers, the people who help people in their homes, the caretakers in their homes who are helping people who have medical challenges or disabilities. Those are all people who are eligible right now. The second group that's eligible right now is 12,000 people who reside in long-term care facilities. And so the total is 50,000 people that are currently eligible. And we estimate as of last Sunday that 33% of those people had been vaccinated, over 16,000. So we have a long way to go. 33% have been vaccinated. I hope that number's bigger today. I think we did 1,500 yesterday. Maybe that number's grown. Certainly Kaiser and Sutter and others are working at it. But we need to get through all of them. And then the next group, next slide, is phase 1B. And this is where the state made a change. And they haven't even really given us this in writing yet. So, but we're pretty confident in it, that the next phase, 1B, will include a first tier of people who are over the age of 75. There's 55,000 of them in our county. And then yesterday they announced that people over the age of 65, which would be another 75,000 people in our county, that those people will be eligible. And we have the impression that those people will come ahead of the next group, but we're trying to get this question answered. And the next group in tier 1 is teachers, childcare workers, other emergency services workers. And we're going to share these slides with you. So don't worry about having to write all of this down. This is, a long list. Police, emergency services responders who are not medical, and people in food and agriculture. And so we estimate that whole group to be about 37,000 people that will be next. Then there's tier 2, and this is another group of essential workers. People in transportation, logistics, industry, commercial, residential, sheltering facilities and services, manufacturing, 68,000 more people there. And then congregate settings with an outbreak risk. So let's think about our inmates. Let's think about our homeless populations. And we're doing estimates there of the numbers. But we know those are very vulnerable populations. Fortunately, the numbers are not really large. So this phase 1B is an enormous group. And I want to make the point that this group includes many people. There's a lot of intersectionality here. As you all may recall from learning about the earlier phases of the pandemic, who has been the most impacted? We have older adults that have been impacted, people living in congregate care facilities. We also have frontline essential workers in these sectors who cannot afford to isolate at home and who live in dense housing situations. So phase 1B is going to really be focused on a very diverse cross-section of our community. Then phase 1C is individuals. That's the next phase. So we're supposed to get through phase 1B substantially, not completely. We're supposed to have offered it to everyone in phase 1B. Then phase 1C is individuals over the age of 50 and people over the age of 16 that have an underlying health condition or disability, which may increase their risk. And then we have another group of essential workers, people who work with water and wastewater, the defense industry, energy, chemical and hazardous materials, communications, IT, financial services, government operations, other community-based essential functions. So a lot of public servants and public services are in phase 1C if they're not in phase 1B. And a lot of our nonprofit partners and community-based partners, if they're not in the first two phases, they certainly fall into phase 1C. Next slide. Okay, so we're really all hopeful about the supply of the vaccine, and the federal government could do something enormous to really make this happen faster. The plan that I'm sharing with you right now is the plan that the federal government and the state have already laid out. So it could change. And right now, the plan is that we're supposed to collectively, between the federal government initiatives with the pharmacies and the VA, and the state initiatives with the large healthcare organizations and the counties, we're supposed to get through phase 1 between now and the end of February. Then we're supposed to start phase 2. And the way it's worked so far is you're supposed to offer everyone in phase 1 a first shot at a vaccine before you keep moving. Phase 2, the populations have yet to be determined. What I will say is if we go with phase 1 and we get through all of those people, that's at least half our county population. That's how big it is, just getting through phase 1. And then there's supposed to be a phase 3 between April and June, which is when all of the public accesses the vaccine. And our hope had been to get through everyone by the end of June, which involves a massive scaling up in every sector. Next slide. If the vaccine starts to flow more generously, there may be some blurring between these phases. And we already know, for example, that our Sutter colleagues, because they received enough vaccine from the state, they have already messaged to their members that they're hopeful that next week they may be able to start doing the phase 1B group. So that's very encouraging. What Kaiser told us is they're not even close to getting through phase 1A yet. It's going to take them longer unless the state gives them a lot more vaccine. So here I just want to acknowledge that these phases may be slightly overlapped. Next slide. Well, a lot of people have asked the question, do we have, how much discretion do we have locally to change the rules up here, and change the populations or have, a different approach. And what I will say is that anyone who's involved with this program as a vaccinator has received very serious warnings from the state most recently that we really cannot veer from their guidance. There are repercussions for doing so. Disciplinary action by the Department of Consumer Affairs licensing boards, preventing us from actually ordering and receiving more vaccines, being kind of taken out of the vaccination rollout program, which of course we would not want to see, and even legal action. So we have been very concerned locally that we follow the rules, while we also recognize that the rules are changing and we hope that the supply will be more generous. Next slide. As we learn about the guidance from the feds and the state, we know that we need to tailor the process locally, particularly the outreach and the distribution strategies, so that we can reach the most vulnerable communities. And here we felt that there were a number of principles for consideration locally, and these are principles that we're really asking for your input to, before they're finally baked. The first is that we provide transparency in the science and the vaccination process, and so that would be a focus that we would take locally, trying to bring the information to our communities that they need to feel confident. Prioritize those that shoulder the most risk. And we know in our communities that there are more impacted populations. There are people who have been clearly demonstrated to be the most vulnerable. Thirdly, we really need to be upfront about explicitly acknowledging that there is a negative and a painful history of healthcare in the United States, in communities of color, in California, in San Mateo County, that has led to distrust in healthcare, in research, in the government. And the depths of this really knows no bounds. I've been trying to learn more. Every time we have a focus on this in a conversation, I learn more. It's very, very present in people's minds. It varies by generation. And here I really appreciate the state surgeon general and the chief epidemiologist process in trying to shed a light on some of this so that we can all learn. Fourth, engage community and stakeholders to better understand their concerns and needs. We're really looking to you for help with this. Responding to those concerns and needs as much as we can, communicating effectively in culturally sensitive ways through trusted partners really learning from the testing and the previous phases of the pandemic, the great work around the census and the outreach in this county. How can we go beyond the written word, the visual, and enlist local leaders? And then, of course, learn and improve as we go. So this is kind of a starting point, but it's not an end point. Next slide. So of the 22,300 doses managed directly by our county, the first doses for medical first responders, dialysis center staff, acute care hospitals, because initially they didn't get their vaccine from the state, so we went ahead and gave them each a first amount. Residential behavioral health facility staff, all of those groups are well underway. And this week's focus has been on especially the health workers that were not getting reached by their systems. And that would include in-home support services workers. We have 6,000 IHSS workers in this county that are represented by SEIU, and thanks to SEIU for helping with the outreach on this. We really want to see all 6,000 of those people get the vaccine. They're helping people who are older adults and disabled adults in their homes. And on Saturday, we mobilized a pilot drive-through clinic at the event center. And thanks to Dana at the event center and many county partners that made this possible. And this was targeted at the priority 1A health workers, including those in-home caregivers. And based on that trial run, we hit, in the beginning, it was 960 appointments, but we were able to get up to 1,500. We were sending people through 5 minutes per appointment through the drive-through. And that was a huge success. So we're feeling very positively about that. And the effort at the event center, we really want to see include Sutter, PAMF, and other partners to be able to get more reach. And we're working on that right now. I also want to mention the progress on the federal long-term care partnership. Mention that all of the nursing facilities, all 17 of them, have been making progress on the vaccine. And we have enlisted Safeway directly to go ahead and start with the largest assisted livings in the county. We expect to reach 1,300 people in the really large assisted livings that have more than 50 residents. Next slide. So let me take a minute and back up just a little bit. President Canepa started a little bit with some of the, how far we have to go to reach people here. I want to give you some information about the big picture in our county. So we have 619,000 adults in our county. And we know that to reach herd immunity, which is really to shut the virus down so that it's not spreading, that we need to reach at least 90% of those adults, 557,000 people. And we also know that because the vaccine has not been tested yet thoroughly in the clinical trials on children, there is not a plan right now to focus on kids. So that's why we are not focusing right now on children. The FDA is not approving vaccines yet for kids. So when you look at the math problem here, in order to hit scale, we believe there need to be at least 6,200 vaccinations a day in the county across all of the different partners. And we believe the county's direct responsibility in that is about 1,200 vaccinations per day. And so we were super encouraged yesterday to be hitting 1,500 in our drive-through. But we also know that our efforts have to be focused really locally on communities that really may not go to a drive-through. Our efforts, like with the testing, are going to have to be informed by your feedback. And as I mentioned on Sunday, we exceeded 16,000 vaccinations altogether, and that was about 33% of the first population in the top priority group. Next slide. So we are working locally on a dashboard because we'd like to be able, we'd like the community to have the same information, similar information that you have been able to get related to testing and other aspects of the pandemic about the vaccine rollout. We have to collaborate really closely with the state on these dashboards because a lot of the data is data that they have, but they are also committed to transparency in this process. They have something called an immunization registry. It's a statewide data system that everyone who is vaccinated has to be entered into that database. And whether you're Kaiser or Sutter or us or Walgreens or CVS, everyone has to enter into that database. And our hope is that information about race, place, zip code, SOGI data, and income data, we'd like that database to be really robust so that we can learn everything that we need at the local level about who the vaccine is reaching. However, right now, we think that database has limitations and that there will be advocacy needed to get that data where it needs to be for us to be able to learn locally what's going on with our community. And the state is going to track key metrics, which, as Peggy explained in the beginning, are really focused on the Healthy Places Index and our lowest quartile Healthy Places Index communities, which essentially overlap with our lowest income communities in San Mateo County, and the communities that we've already seen in the pandemic have been most impacted by COVID positivity. When you look at who has the 14% positivity rate and who has the lower positivity rate, it is our lowest quartile Healthy Places Index communities. Next slide. So this is really just a recap of what Peggy already described regarding the direction that the state is taking around the vaccine equity metric. It's not finalized yet, but we're really moving forward with the thought that it aims at preventing disparities between communities in the vaccine take-up. Next slide. So here I want to acknowledge, just honestly, the word cloud, I think it said a lot about the concerns that people have. But to go ahead and put some things on the table that are understood to be barriers to getting full reach of the vaccine across our county, and also acceptance that people personally would be willing to accept the vaccine. So the first item is just the operations of obtaining the vaccine for people who are insured and for people who are uninsured. We all know that the systems that actually support getting the vaccine, often those systems have intrinsic barriers that mean that our lowest, that the communities with the least opportunity are at the end of the list. We do not want to have that happen in our county. The second is the distrust that I mentioned earlier of the government, of research, and of healthcare, of us. Thirdly, misinformation. We already see misinformation circulating on the web about the vaccines. And so that will be something that we have to actively combat. Safety. There are very legitimate concerns about the safety of the vaccine. Which communities were they tested on? Who was missed in the FDA's process? Privacy, immigration status. We know that the sectors that we most partner with to help reach our communities, that there's capacity building that's needed across those sectors. Just the accessibility when we talk about where you physically go to access the vaccine. How accessible will that be? What will the process be to prove eligibility? From what I just described, you heard this long list of categories. Are people going to have to prove, that they're in those buckets? How will that work? And then, of course, how will they learn when and how to receive the vaccine? Next slide. So we think a good starting point for our local work is specifically around acceptance and communications is one that was started by the state, which is that the communications framework must acknowledge the complex and nuanced personal and community experience, and understanding that lived experience shapes the willingness to accept the vaccine. So, this drives in the direction of enlisting people who are representative of our communities and have lived experience in the communications framework. A commitment to engagement by partnering with communities across San Mateo County to share knowledge and information about the vaccines. A commitment to action by providing culturally competent, fact-based messages so that everyone can make an informed decision about vaccination. And then finally, remaining committed to those principles of safety, equity, and transparency. Next slide. So the state campaign so far is focused on developing tailored social and digital content. So we will be able to look at that locally and decide how to use it. Ethnic and multicultural media through state media briefings, news articles, and live reads on the radio. There will be both organic and paid strategies. And then again, they will be leaning on their advisory subcommittee in order to develop those strategies, which we very much want to lean on. Next slide. My computer is timing out here. So we want to make it as easy as possible for the voices of our local partners to be heard at the state level because there is so much happening there. And so we have one strategy, which is we've partnered with the California Pan-Ethnic Health Network, which is CPEN, and they are a statewide health equity advocacy organization. And they've agreed if we want to come to our meeting and help reflect our views back through their channels regarding equity considerations in the state process. And this image here is a picture of their coalition letter to the state regarding vaccine guidelines that they sent earlier in December. And so they have offered to come to one of our upcoming meetings to provide an overview of how they might integrate our feedback into their effort at the state level to advocate. And we know that many of our voices, that people have limited bandwidth to do even more meetings. So we're looking, how can we be most effective here? But I did want to note that the committee itself at the state level has public opportunities for feedback and advocacy, and these are posted here. And they did convene an emergency meeting on Wednesday night, but these are the formally planned meetings if you're interested in getting more directly involved. Next slide. So locally, we have already been doing information sessions and presentations. And you may be aware that we did a live stream on Wednesday with support from the Office of Community Affairs. We're providing presentations at community forums and trying to learn through those interactive opportunities. And this is similar to what we tried to do in other phases of the pandemic where we had COVID town halls so that we could learn. And we're interested in doing more of those. We are also trying to develop partnerships with community-based organizations and clinics so that we can do stronger outreach at the local level to our Black, Indigenous, people of color communities. And then of course, we want to work with you all to expand that repertoire and build it out. And then we have created a community liaison. There are a lot of emails coming in, and we have already been receiving a lot of communications just with other concerns about the pandemic, but we've created a liaison to answer questions, which is reached through covidvax@smcgov.org. And that person is really trying to get to each individual who is reaching out with a question. So with that, I know that was a very long presentation. It's really just an effort to get everyone at the same starting point in terms of information. And now we will turn to questions. And of course, as a part of that, welcome your feedback regarding that 7-point equity approach that I mentioned earlier.
Thank